Hello and welcome to the Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our guests today, I would like to share a few thoughts with you. For those of you who watch the program, you know that we do want to give you an update on COVID-19 and how it's affecting our community. So there is good news regarding the decline in the number of new cases of COVID-19 in Grey Bruce, although this does fluctuate from day to day, I've noticed as I watch the numbers. The public health unit could not have done this without the help of the community, and they need us to keep up the good work. It has just been announced that our lockdown is now extended to June 2nd, 2021. This is very difficult news to hear for all of us who are just aching to have those restrictions lifted. I think that we can all agree that we want to make this lockdown the very last one we'll have to go through. We're looking forward to the lifting of the restrictions, but in the meantime, please follow the provincial stay-at-home order by not going out except for absolutely essential travel. If you have any possible COVID-19 symptoms, go to the assessment clinics for testing. Be open and transparent about the people that you may have been in contact with. This might actually save their life and those of others. The Grey Bruce Health Unit states that it is crucial and critical for all of us to stay the course with the 3 W's. Wash your hands, wear your mask, and watch your distance over the next coming weeks until our vaccine rollout is complete, hopefully this summer. This journey has been long, and we're all very, very weary. The sacrifices we continue to make each and every day will bring all of us closer to the finish line. Let's make this difference together. Thank you to all of our community who are working hard to help move us through COVID-19. And on that note, I also want to welcome and thank our guest who's arriving to the program today. Ann Elford is here to talk about residential hospice and Chapman House. And thank you so much for being here. Not sure if you can tip your, you read my mind. Tip your screen so I can see your face a bit more in the screen. So welcome and thank you for being on the program. I'm wondering if you can tell us a little bit about yourself. And then certainly we're keen to hear about the update on residential hospice and how you've been doing through the COVID-19 pandemic.
Well, my name is Ann Elford, and I am a registered nurse here at Chapman House. I have worked here since just before we opened, and so we were over at Seasons originally, and then we moved over here. So I've been involved with that since we opened. So lots of changes has happened over the past 8 years, for sure. Going from the build and the excitement of moving into a new building. And I can't thank our community enough for providing the funds to support this building, because it really makes the experience much more rich for those coming in. Not that the care has changed since Seasons, but the environment has, and it's a really nice space we have here, and I'm grateful to all the donors that have given to our community, to our home here, to make it a home away from home for people at end of life.
So we're going to be talking about fundraising initiatives. I'm not sure if this is, why don't we talk about what you're doing for fundraising? We might as well get the ask right out there, right at the front, but then I don't want to miss that opportunity. Now, you don't get all of your funding for operations through the government. You do rely on donations, right?
43% of our funding comes from the government, and the rest of the funding comes from community dollars and donations. So I look at it as our frontline staff, we're covered. But then the rest of the things, our heat, our hydro, our maintenance, our secretaries, and none of that is covered. So that comes from donor dollars. And our donor dollars, we do fundraising initiatives, third-party fundraisers, and we have our hike coming up as well. So it's a lot to raise those dollars. And again, I'm grateful to the community for keeping us going. And but again, our building looks beautiful, but we still need to raise dollars all the time.
Now, with COVID-19, a lot of organizations are really, really struggling because a lot of the events just can't happen. How are you suggesting, how is this hike going to work if we're not outside together hiking? What are you doing?
So we've taken the hike virtually this year. So anybody can hike, and anyone can hike in memory of someone. So it doesn't need to be somebody that died at hospice. You can hike in support of someone you've lost in the last year. You can hike for hope. That was I just did a run yesterday. I ran 8 miles for my hike, and I'm running in memory, and I'm running for hope. So my campaign was, I'm hoping there's an end to COVID. I'm hoping that I get to see my friends again. I'm hoping I get to see my family again. So all of those things that's why I'm running. So again, just being out in the environment and getting outside. So we're trying to pitch to get people to buy into, you can put it out on Facebook. This is why I'm hiking. And we've been doing some news feed on Facebook that shows kind of, you can see my run, you can see a lady that's been walking with her son. So that's how we've been trying to raise money. And actually, Hike for Hospice is our biggest fundraiser. So we have communities, we want community involvement as well. So Amy and Lisa Campbell were supposed to be going out. They have a truck. I don't know if you've seen the blue truck with the wrap on it for Hike for Hospice. Looks fantastic. Anyways, they're supposed to do a road show, but once to different communities, but we have to wait till lockdown stops.
Okay.
We're also doing a broadcast. So I'll be giving some information about advanced care planning. And so we'll be having a broadcast that will be on Hike Day.
So Hike Day is officially what day?
We have a whole month of hike.
Okay.
So you can hike anytime.
Okay.
So we'll try to kind of wrap things up by the end of this month, but you can hike any day. So
Okay.
There's no set day where hike used to be, a certain day, but go ahead.
Mm-hmm. So, for example, people who want to participate, who may be watching this program and want to participate, they would go online and would they fill out a pledge form, or would they just donate? And then how do you know? Do they send you a picture? If I want dog, do you want a picture of my dog?
Sure. So before, people would get a pledge form and have and do the hike. And but you can register online. So if you go onto our website, there's a whole a package that will walk you through how you could do it online. If you want a paper form, we can send you a paper form and you can go out and get pledges. But with social distancing, it's hard to kind of do that right now, to go door to door like we used to. So you'd have to email and then talk to your family members and work out your pledging that way. Mm-hmm. And we have teams too, like some of our staff have made teams and are raising money too. So we kind of have a competition going between staff members as well.
Excellent. So people can participate in the Hike for Hospice, but for those who maybe have a few other challenges, they can just donate, right?
Exactly.
Yeah.
We'll take a donation any day.
Yeah.
You don't even have to hike to give us one.
Yeah. No, and that's excellent. I mean, it's with the COVID-19, being able to raise the funds is even more critical because the services need to continue, but the resources may not be as easily available. So I wanted to be sure you got that out there right away.
And the other thing that I want to say to families too, when we're thinking about in memoriams and thinking of our loved ones, we do have Hospice Heroes as well. If you look on our website, you can buy a day in memory of someone. So, there is that as well that I think is really important. If you want to honor a day, so, everyone has, say, the day that somebody passed away or the day that it was somebody's birthday, they might want to honor that day by sponsoring it at hospice and telling us their story about that. I think what we're missing, and I even have noticed with Nurses Week this week, there's people like to hear a story about why this is meaningful to them. So just like hiking, I think you need to give it meaning in order for it to kind of sink in and mean something to you, but tell your story to somebody else. So with the calendar, you can do that. So you could put a picture up and we'd have it on the website and tell your story of why that's meaningful to you and sponsor a day.
And it makes it personal, and it also keeps memories alive.
Yeah, and it honors that person, and I think it's also a way of healing and grieving as well when you honor a day or honor the spirit.
Excellent. I really like your phrasing, hiking for hope. I mean, what better thing than to hike for hope, right?
Well, our hope has been dampened with COVID and being a frontline worker, and I can move into kind of COVID restrictions from here. I feel like for the last year, we've been doing palliative care with one hand tied behind our backs. We're an open door. We don't have volunteers right now to assist us, but we also have to have visitor restrictions. And we've never had to not allow family members to be with their loved ones. So if I could speak a little bit about that, with the COVID restrictions, when we first locked down, we had only one designated visitor per family. And this really, I think, impacts people's decision to come to hospice. I'll try to debunk some of those restrictions for families so that they might clear the waters on making things more understandable with restrictions. If you go on our website, we have developed 3 stages with COVID, stage 1, 2, 3. Stage 1 is full on lockdown, but within that, we have 2 designated visitors. So that means that 2 designated visitors can come in to be with their loved one. Mm-hmm. If something is changing with a person's condition and end of life is getting nearer, we get an order from the physician for more people to come in to see the loved one. With COVID, though, we used to have 4 people in the room, but we have to still restrict it to 2 people at a time because in the space of the room, you have to be able to have social distancing. Families are provided with a surgical mask that we ask them to wear while we are in the room. But if we're not in the room, you can have your mask off. But if we come in, we ask that families put them on. Where we've been blessed is in our design of our building, each room has a patio door that goes outside. So that has been a real saving grace because anyone can come and visit at the patio. So if there's a family of 4, you could have 4 people, you could have 2 people internally, but 2 people on the outside as well. Loved ones can go outside. I'm grateful for the better weather. If the person is well enough to go outside, they could be outside with a loved one with a mask on. So that gives more flexibility as well. It is hard because everybody's an individual that comes to hospice and that is in each room. And where it's hard for families to understand is that if I bend the rules for one, I end up with 32 people in the building because if I allow 4 per in one room and then we have 8 rooms, that's 32 people in the building that I have to screen for and make sure everyone's safe. Luckily, touch wood, we haven't had COVID in the building yet. There has been some hospices that have experienced that. And we just don't want to put our loved ones or our families at risk. But it's just as hard for us to have to put that restriction on as it is for the family.
Yeah. As you're talking, I can't help but think how much more challenging for you as a healthcare professional this must be, because you would recognize how important it is to have visitors and family present. How do you cope knowing that you've had to do these restrictions?
I think you have to have a Teflon coat on for sure. We really encourage with the staff self-care. And what we've done is we've tried to kind of make it that the physician makes the final decision, and I'm the care coordinator here in charge of intake, and we've made kind of two spokespeople to make decisions and talk to the families with regards to what the restrictions are. If we're moving and having more people involved in communicating, it just gets muddled sometimes, and we want to be clear in our messaging. And we try to deflect it off staff because it's stressful. And when somebody's upset, it's better to talk to one person. And so we've been trying to kind of keep that in place for self-preservation in some respects.
Yeah. And has that worked a bit better than doing it with that channeled communication?
Yes, it has. And we've also, what we've done with the COVID restrictions is we've made it a consent. So when people come in, they actually sign the consent form. And then on the back of the form, they have to identify who their two designated visitors are. And then anybody that's coming to the patio. Over time, this past year, you learn how to do things more efficiently. And then you also learn how the spread happens. So you can become looser in some ways and stricter in other areas to make sure, like we were full on PPE and face shields and everything for a while. And then as we learned that it wouldn't transmit so much that way, we've become a little looser we wear goggles and masks, and we're in full PPE for 14 days when somebody comes in stage 1, but we restrict it down to 12 days of full PPE if we're in stage 2. So you can look at any of the restrictions, but I think having it at like a red light, green light, yellow light restrictions, it's made it really easy when we go into lockdown again. I just know where I have to flip to, and then the families are told. So I will be really happy to loosen up these restrictions as time comes, as we get vaccinated and come. And also we've made one change in the last month with this lockdown. Anyone coming into hospice has to have a rapid COVID swab before they come in. I have to give a shout out to the paramedics within Gray and Bruce, because they're doing rapid COVID swabs for us before we admit. The paramedics have really done a fantastic job at helping us get people to hospice quickly, but with a negative swab.
And certainly, I agree. The paramedics have been an absolutely wonderful resource for our community in so many different ways, and I'm pleased that you mentioned them. It takes a community together to get through this and to support each other. And we're all in this together, and we all want to get through this together for sure.
We've actually had paramedics. We did some training with paramedics, and they were here for a day shift, and so they learned some symptom management and symptom response from us, and it's a really great program. And it built relations, right? So in a time of restrictions and not seeing people, it was nice to have that opportunity to build some relationships with the paramedics and for them to see what we do here at hospice. So if people are at home and trying to stay in the community before coming to hospice, the paramedics there's a group of paramedics that are now trained that can go out and do symptom response, which is really a great thing for our community. And having that experience of seeing how palliative care nurses react to symptoms gives them more experience too and confidence.
Excellent.
So that's been really good. Mhm.
So certainly the lessons from hospice are going out beyond the walls of hospice into our community as well with the paramedics, which is wonderful outreach for sure. Now, I know in the past, volunteers have been so important in so many different ways. And for many volunteers, this has been important to them to be able to provide this service. What are you finding and what are you hearing about from your volunteers? I'm sure they miss being there.
Our volunteers definitely miss being here, and we miss them so much. We did with stage 2 have our volunteers come back in just in reception. So they were working reception, and they came back for one day before lockdown. Broke our hearts.
Yeah.
But our staff, as far as COVID fatigue, when we're busy and then with donning gowns for 14 days when we're going in rooms, we are doing all the laundry. So we miss our laundry volunteers. We miss our kitchen volunteers, all of our volunteers we miss. And it's been workload. Everybody's workload increases. So nurses and PSWs and the RPNs here, we wear a number of hats. We clean, we do laundry. We help with meals. Our cook, she's restricted from coming in the back too. So that makes it, when I say one hand behind our backs, yeah, we're missing our volunteers for sure.
Yeah. And certainly that linkage with the community as well. Yeah. Yeah. You also had volunteers who provided, programs or music or, they help with functions, but you also had that as well, I believe, correct?
Yeah. So we had volunteers that came in and sang. We had pets that came in every Tuesday. So yes. We're seriously missing that. So some volunteers though are still doing bereavement follow-up for us. So we have some volunteers that are specially trained, and so they're doing phone call follow-ups for us and bereavement support. One program we've been able to keep going virtually, and I thank Jan and Lisa Campbell, Jan Temple-Jones for that, and Lisa Campbell, is the bereavement follow-up. And we've been doing conversation cafes virtually for bereavement support for families. And so our volunteers will do follow-up at, we do 1 month, 3 months, 6 months, and a year follow-up with families who've suffered a loss. So they have been helpful in that respect and been able to carry on that, thinking outside the box a little bit with virtual cafes and things like that. So.
And that's certainly great. So you mentioned you're doing a lot of functions for sure. How are you for staffing? Do that's always a question.
Well, staffing is always. We have some challenges. We are hiring actually RPNs right now. If anybody wants to apply, we're looking for casual positions. So I think we have a full complement of staff, but it's tough. And even with COVID and vacation relief, you're coming into the summer, and like last year, I think we had to restrict some holiday time for people. And, we don't want to have to do that this year. So everybody on our team is very flexible, and they work together because we have to be, we have to have registered staff in the building at all times, right? So we pull together when we have to. Both this manager and myself are registered staff. So if we have to work on the floor, we do.
Yeah.
It has to be a team effort.
For sure. So I know in some circumstances, physicians have had to do virtual or remote assessments. Do you do that in hospice, or is it in person?
Initially, with the first lockdown last year, our physicians chose to stay out. And so we did virtual rounds and patients where we dealt with patient care that way. Now they're in. Our physicians come in and our family physicians come in as well if they're managing the patient's care. We changed that. Again, it's a learning curve. So virtual with the less outbreaks that we had. If there is an outbreak and any of our physicians have been exposed, say at the hospital, then they would not come in.
Right.
So we right now they're coming in, and it's also important for loved ones to see the physician as well. And eyes on is always better to me.
Yeah, for sure. So certainly the preference is in person, but you have plan B if it needs to happen, that they
Exactly.
have to. Yeah.
And if somebody, and that goes for chaplaincy as well. Originally, when we were in lockdown, we didn't want, we kind of restricted chaplaincy, but that's changed as well. And our in-house chaplain is here all the time too.
Excellent. So we have about a minute and a half in the program. I told you I'd have a lot of questions. So is there anything you'd really like to profile in the last few bits of time we have left together?
All that I'd like to say is that I appreciate people's understanding of us during COVID. And if anyone has any questions or we are always available to answer anything. So if there's a question about how do I make a referral, how do I get into hospice, please feel free to call anytime, because you're most equipped if you have knowledge of what is happening, what stage you're in. We're always willing to answer a question anytime. So I think that's what I really want to reinforce, is that never think you can't call here, because we're always willing to guide and help people navigate this rocky road at end of life sometimes, or even with treatment and next steps. And I really encourage people to make sure they're prepared and get what they need to feel equipped.
Excellent. I want to thank you so much for being on the program today. And I do want to remind the public about hospice, Hike for Hospice, and should you wish to make a donation, please do so. Thank you. Thank you to our viewing audience as well for joining us today. Please join us again to learn more about programs and services available to you and to your family. Take care, stay safe, care for each other. Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
October 5th, 2014, my daughter was hit by a train. She was walking along the sides of the tracks, and it shattered her world.
Being stuck in your home during this pandemic also means you have a home. Waiting in line for groceries means you have money for groceries. The isolation, being broke and